happy because we are here.
Yeah. And you just made a great presentation on why a patient's voice is in remission, and talks about remission and therapy and treatment is important.
It is very important. And the reason is that there is a discordance between the physician point of view and the patient. Usually, as physicians, we use the clinician-reported outcomes, and clinician-reported outcomes miss a part of the, let's say, the story of the clinical picture. So we know this from the literature that, of course, if a patient is in remission, the patient is better. If a patient has less damage, the patient is better. But not everything is not there. So we need to understand that we need to evaluate the patient-reported outcomes, and we need to understand how to integrate patient-reported outcomes in the way we see the disease, the patient, to obtain an holistic approach. We always talk about patient-centered care, but then something is missing. From the part of the physician, as a physician, I'm telling this, that sometimes I feel that it is missing.
Yeah, and I think that's the important part, that I can give the patient's perspective, but you can give the physician's perspective.
Absolutely.
And try to see it from a different point of view.
Yes, and the other point that I think it's very important is that the patient point of view doesn't mean that it is not disease activity. So sometimes there is this idea that the physician is following disease activity and the patient is reporting maybe on something different, particularly when I consider the disease in remission. So if I see the disease in remission, then probably the patient complaint referred to another area. It's not lupus, so should not be used to change the treatment, let's say. And I think that this is not completely true, that we need to think a little bit more about this, because the patient point of view on disease activity matters. And if we think this way, we may miss something. That is important. That may drive a change in the treatments. We do not know, but some data in the literature suggest this as well. So we need to reflect, and we need to have additional data.